Hello, I'm Dr. Rudy Kasha, and if you're watching this video, then you're interested possibly in doing something to your eyelids. Or you're possibly coming in to see me for that, and we're going to give you some information to help out with that process and make things a little more clear. So particularly the eyelid procedure is called a blepharoplasty. So upper lid blepharoplasty, lower lid blepharoplasty. Similar, but doing a little bit different things to each. Also, this may be done in conjunction with other things like a brow lift or a facelift. So if you're thinking or considering those as well, make sure you watch those videos because we won't cover that in this one, but all the details will be contained in that. So with an upper lid blepharoplasty, let's start there. That's typically someone that has a little extra skin to the upper lid and that has oftentimes some fullness in that medial aspect, because there are two fat pads in the upper lid. There's a medial and a central. And so we want to address all of that. So very simple surgery. Literally making an incision in the crease of the upper lid so it's hidden, and then an upper incision above that depending on how much skin is there. Taking out that strip of skin, we also take a strip of muscle out to tighten it up a little bit, and then taking out part of that fat pad there so that fullness that's there is gone. That's really all it is. It's typically done under IV sedation, very, very simple. With that, a key concept to know, something I'm evaluating when I'm looking at you, is what's the relationship of your brow in that. So if someone's brow is appropriate, in a woman that's about 1 centimeter above the bony rim, in a man it's practically at the rim itself. But if it's appropriate there, great, all we need to do is take that skin off. But in some people they can have drooping of their brow. We call it brow ptosis, P-T-O-S-I-S. And in that case, if we take that upper lid skin off, we haven't dealt with one of the main problems, and that's that brow ptosis. And so it'll seem like, oh, you left some skin, Dr. Kasha, and you could take more, when really that's what's attributable to this brow being in the wrong spot. And what can happen even afterwards is what's called compensatory brow ptosis. So now while you're sitting there, if you really have some droop of your brow, your brain is subconsciously telling your brow to hold up. And it's helping with that upper lid skin. Well, when I go in there and take just that skin off without addressing the brow, then your brain doesn't have to tell your brow to do that anymore, and your brow actually drops more. So you get a heavier brow look, and it looks like more skin just came back to your upper lid that we just took off. So those are the scenarios where we would actually need to do a brow lift with the upper lid blepharoplasty. So that's something we'll be evaluating that day as well during the consultation. For the lower lid, it's an incision that goes right along the kind of the eyelash margin, basically where a woman would put eyeliner. So it goes right through there, then extends out laterally just slightly. We lift that skin, and then we deal with the fat pads. So there's 3 fat pads in the lower lid. That's usually the main issue in someone with their lower lids. It's not that the fat's growing, but it's that the septum that holds the fat in gets weaker with time, and that fat kind of pooches out somewhat. And so you get the puffiness of the lower lids, and then at the same time what's happening is the cheeks dropping just with aging, and so you get more of a transition zone. So sometimes in the same time with that lower lid, we'll actually either put some fat in the cheek, and or sometimes we do a mid-facelift or a facelift to try to address that, to smooth that vector out more so. But specifically with the lower lid, we're just dealing with that lower lid structure itself. We'll take part of those fat pads out, redrape the skin, and close all that up. We do want to be fairly cautious with the amount of skin we take off. We can be kind of aggressive with the upper lid amount of skin we take off, but with the lower lid we want to be very cautious, because you can have what's called kind of a hyperactive scarring internally of the lower lid, and it can pull down on this lower lid, giving you what's called ectropion, or lower lid retraction, kind of that puppy dog look. We don't want that, doesn't look good. So does that happen? Yes, it happens every now and then just because of the hyperactive scarring. Typically dealt with just by massaging this and having you stretch that out. It does just fine. On very rare occurrences, it can require surgery to readdress that. But that's something we're being careful with that. But that should help smooth out the lower lid, make that look really, really nice. Other things we check for is, do you have any pre-existing dry eyes? Because these surgeries around the eyes can make that worse. If it's just very minimal, probably fine to proceed. If it's really, really bad, requiring drops multiple times throughout the day, it may be something we say, probably should avoid this, because that may become something that very much impacts your quality of life if you were to have that complication happen. So that's something to know as well. We're working around the eye, so risks of anything that you could conceivably think of there. I don't expect anything like that to happen, but it's important to know that could happen as well. Risks of bleeding, infection, anything like that that's typical with surgery you should be aware of. Corneal abrasions, usually that even just from wiping around the eye with gauze if something was to scratch the cornea a little bit. Mainly just means a little irritation for a few days. We use some eye drops and then that goes away, but that's something to know as well. With that in general also, I would look at the paperwork you're going to get from our office, and it'll tell you all the details from risks and that sort of thing with surgery. So read through that just so you're fully informed. But the things we just talked about, those are kind of the key things that are very pertinent to this type of surgery that you want to be aware of. For the surgery, like I said, done in our surgery centers, we most of the time done under IV sedation with our staff, that both myself, nurses, scrub techs that are all used to working together every day. And then for the surgery itself, about an hour per top or bottom, so hour for upper lids, hour for lower lids, 2 to 2.5 for total, and then longer if we added some other procedures in that, like the brow lift, obviously, or the fat grafting or that sort of thing. Then you'd spend some time in the recovery room. You'd go home, see me usually 1 to 2 days after surgery, make sure everything's doing okay. Your sutures come out usually around 5 to 6 days after surgery. We'd check on that at that point. Everyone's different how they look. It's not very painful at all. Sometimes a little irritable in the eyes, but not painful. But you do swell a little bit, you do bruise a little bit. It may be a little, maybe a lot. You may look pretty good in a week or two, or you may notice for even a few weeks or so that something was done there. So just kind of be prepared for that from that standpoint. But overall, very simple surgery. Even some of the ladies in my office who've done their upper lids like during the day, and then they keep working the rest of the day. So it's a very simple, straightforward surgery from that standpoint. So hopefully that helps give you some information on what a blepharoplasty or an eyelid lift is all about. And if you decide to come see me for a consult, or you're already coming in, I look forward to meeting you.